Hello, hello. All right. Today was the day. I'm excited to chat with you guys. Got some news and I am excited to share with you guys. So, first of all, hi, Christina, if you're new to my channel. 11 years post-op, vertical sleeve gastrectomy. I've successfully kept off over 100 and I guess 20 pounds or so, 130 pounds, 140 pounds, whatever it is, over the last decade. Currently, on this kind of vlog, I am talking a little bit about some complications that I've been having post vertical sleeve gastrectomy. So the quick recap is about 5-6 years ago, I started to have reflux issues, GERD, gastroesophageal reflux, which is super, super, super common with a vertical sleeve gastrectomy. And if you're looking into having surgery or you've had the surgery, you know that they usually do an upper GI to make sure that you don't have any esophageal dysmobility, you don't have any hernias, and you don't have GERD. 11 years ago, I was fine with all of that. However, I guess probably with age and with having a tiny tummy and all of this, I have developed reflux pretty horrendously to the point that I have not been able to eat very much. And I'm down I actually quit weighing myself because I have, an eating disorder and I need to just not weigh myself. But I'm roughly about 30 pounds down since January 2022. It's now September 2022. So it's been about 9 months. So it hasn't been super fast, but I don't have a ton of weight to lose. I'm about a size medium top. Well, this is a medium top, so I'm a medium top. About a size, I don't know, women's. I was putting some pants on the other day. I'm about a size women's 12. Anyway, so I talked a little bit about my fear and what I've been going through and how I've been putting this off and I know that the big fix for reflux. Sorry, it is 114 today in California in the Central Valley here in Sacramento, and I turned off my AC trying to be cool so that I'm not sucking all of the AC for all the other people because we're having blackouts now. So sorry, I'm a little warm, but anyway, so I had just talked a lot about my anxiety and my fear and kind of putting this off and that I didn't want to get a Roux-en-Y, which is for those that might not know what a Roux-en-Y is, it's the big surgery, I've always called it. It's the for real weight loss surgery, like the vertical sleeve, is it? It's the oh my gosh, why is the word not Roux-en-Y? The rerouting. It doesn't want to come to my brain. That's fine. It's because I have a lot of other things on my brain. And I went and saw my doctor last week. I actually was making some videos from the doctor's office and then I got embarrassed, so I turned off. But I was so nervous to talk to my doctor last week. But I talked to my primary care physician. She has the best bedside manner of all. I was very anxious talking to her going in because she originally did not want me to have bariatric surgery just because of this kind of stuff, because of the complications. So I don't know. I guess I was afraid she'd be like, I told you so. But she did not. I told you so. She had textbook the way a doctor should behave. My doctor behaved and was empathetic and listened to my concerns and validated my concerns and did not make me feel less than, and agreed that we needed to move forward with seeing what the problem was. So she ordered an upper GI. She actually ordered a modified barium swallow study, which was not the right order. And today I went in and got my study done. And the X-ray technician, the doctor said, you don't need a modified barium swallow study. And for those of you don't, that's actually just checking this portion, because I do have what's called dysphagia, which is a swallowing issue because I'm vomiting and throwing up a lot of the food and acid, which usually we'll put in. And fun fact, if you don't know, if you're new here, I actually am a speech language pathologist and I used to specialize in swallowing. So I used to do modified barium swallow studies. So I was like, that's the wrong order. So she was able to change it to what we call an upper GI. And if you've had any kind of weight loss surgery, you've all had an upper GI, and we all know how fun they are. I don't know though if you've had it, like in the comments, let me know, have you had an upper GI after weight loss surgery? Because that's a fun beast. So this morning I went in at 9 o'clock and I had an upper GI. It was so funny. Like, it was like a series of events that I was texting our employees, and like I was laughing about it. But the x-ray technician that came in was kind of funny, but I was like so nervous. I couldn't like get his jokes, but he ended up actually, if you work in the medical field, like casebook, like how you should be with patients, you know, he's making it light. I love what he told me when I was in there, and I was so nervous. I'm sorry, I keep messing with my hair. I was so nervous, and he was just like, who's in control? And he goes, who's the boss? And I was like, I'm the boss? And he's like, you're the boss. You're the patient. You're the boss. So we're going to ask you to do stuff, but if you're unable to do it, you're the boss. It's your body. And I was like he gave me some semblance of like feeling like I had some control over my body, which I really appreciate. So if you're in the medical field, like that's really good bedside manner. Like very appreciative of the way people in my area, like I go through Sutter. It's just been perfect. Really caring about the patient's whole person instead of just the problem and trying to get them out of the office. Like, love that. But I'm so curious if you guys have had these upper GIs post bariatric surgery. So they're kind of a pain. In order to have surgery, they're a pain to get done. You have to like drink the barium, and then you have to like turn around really fast and like do all these things because they basically want to see like how the bolus and what's going on and coating your upper like your stomach, or now what's left of it, your upper intestines, the duodenum, the upper and lower esophageal sphincters, see if you have any hiatal hernias. And then he was like, we're going to make you drink this fizzy stuff. And before the radiologist came in, he was like, we might not do that because, you know, you're special because you don't have a stomach, or it's like really small. And then he goes, or maybe we'll just do like half. And then when it was time to do it, he was like, are we actually doing this? And she goes, yeah, we're doing it. And he's like half the fizzy? And she's like, no, the whole thing. And he looks at me like, I am so sorry. I was like, it's okay. It's okay. I want to get good imaging. I want to know what's going on structurally. So he gave it to me, and they were like, don't burp. Y'all know after you have surgery, like giving anything fizzy and not burping is pretty much impossible. And I did a little burp, but then I kept the rest down, and I was like, holding my hands, and they're making me like drink all this barium that was like thick. And then they put you on your stomach, like face down on your stomach, and then they give you a straw, and they're like, okay, and it's a thin liquid, and they're like, now you have to drink all of it as fast as you can. I was like, with the fizzy, oh my God, you guys, I can't even. And so of course I threw up, but they were cool. They got enough down to see everything, and then they were like, deuces, and I took off, and I said, when am I gonna see? And again, this was this morning. It's Tuesday, the day after Labor Day. And I said, when am I going to get my results? Thinking it'd be a couple days. He's like, you'll have them in a couple hours. Okay, so I saw them at 9, and I got my results at 2, like 1:30 or 2. Like, how cool is that? Anyway, it's exactly what I thought. Without getting too much in the anatomy of what they said, there is gastroesophageal reflux, which we knew. There is some form of a stricture, but without noticeable stenosis. So stenosis is when, like, if you have an area like this and there's like a narrowing, right? So they couldn't actually see any narrowing in there, which is good, but there is a stricture of some sort. So my guess is like with liquid, it probably goes down, which is what I've noticed, but it might be like really holding a hard, like meat, stuff like that. That would make sense of why I'm unable to eat a lot of like the hard solids. And then there was definitely a change in the mucosal membranes, and there was a hiatal hernia. I'm not sure if I said that, but yeah, there's a hiatal hernia. But the esophagus, like, didn't look like there was any dysmobility, which was cool. I thought there was some dysmobility, and that doesn't seem like what it was. It definitely sounds like the hiatal hernia, the stricture, and then obviously the mucosa in the esophagus is damaged secondary to the reflux, which we already knew. So the recommendation from the doctor who performed the upper GI was to have an endoscopy. And an endoscopy is where they actually put a scope down into your esophagus. Sometimes they'll do a biopsy with that and like make sure you don't have Barrett's esophagus, which is the leading form of, or like one of the leading forms of esophageal cancer that can happen from GERD. It's pretty rare, but to actually have the cancer, but it's probably the start of Barrett's esophagus. I mean, like, it makes sense just based on the readings. So I sat on that for a little bit and thought, and I was like, okay, so I guess now it's got to go to my primary care physician who's going to read this, and then she's going to probably recommend the endoscopy. And she had already sent a referral out to a bariatric surgeon through my plan. And I was like, I'm just going to call them. I'm going to call the bariatric surgeons in the department and see what the wait is to see a surgeon, because I can either wait for the referral for the endoscopy, which is going to probably already tell us what we already know. Like, I guess I'm done waiting is what it is. I've been waiting and waiting and waiting and like not moving on this and getting scared. And since I have some wind at my back right now, I'm like, let's just do this, thinking it's probably going to take a couple weeks to get in there anyway. So I called, and you guys, today is Tuesday. I have an appointment for Thursday morning at 6:45 a.m. And I just said, whatever surgeon will see me, just so we can go over this upper GI and get his recommendation. Like, I'm ready. And she's like, they literally just opened it up for 4 new patients. And I had just called. So I think that was a God thing. I was pretty stoked about that. Also really super nervous. And then I'm like, well, let me look, so I got on the books. I'm going to go there Thursday morning, 7 a.m. And I'm just laughing because it's all moving so fast and I'm so scared. But I'm also really proud of myself because it's taken a lot for me to make these strides. So I'm going to go there Thursday morning and we're going to see what they have to say. And whatever it is, I'm going to go in with an open heart and an open mind and without prejudice, in the sense of like, I don't want to go in thinking they're going to say one thing. I mean, if I'm honest, I think there's going to either be 2 options. I think it's going to be either possible dilation of the stricture and treat the gastroesophageal reflex and like go from there. I think that might be the lower form, but I already have a hiatal hernia that needs to be repaired probably. So my guess is they're going to recommend a Roux-en-Y. Based on all the research and everything I've looked into, that's probably going to be the recommendation. And I'm okay with that. I think my biggest concern is we're going into wedding season. Oh my gosh, 114, but it is going to be getting cooler. And we have, I think, 16 more weddings on the books between now and the end of the year, maybe less. And these surgeries put me out for a little bit, and I don't want to just not show up for a wedding couple. Like, that's really important. So I have to look at, if that's the recommendation, when can I actually do it within my books? It'll probably be around Christmas time, which is kind of a bummer. But I'm okay with this, you guys. I have finally, and honestly, a lot of comments that people have made, whether it's here or on TikTok, or just in my personal life, my friends and stuff who have had a Roux-en-Y, gastric bypass. Sorry. That was the word I was thinking about earlier. That's the other word for a Roux-en-Y. They've been very encouraging, and like, I've had people say, why are you afraid of that? It's not that big of a deal. And I think it's just because I didn't want any more downtime, and I am in my 40s and I've had multiple surgeries, and honestly, like a Roux-en-Y, like your weight loss is sometimes even more significant, and I don't know if I need to lose that much more weight. I don't want to look haggard, and I've looked haggard before when I've gotten down to the 160s, that like I'll have to go, well, I pretty much am already on a liquid diet, huh? See, I love these blogs. Like, they're, as much as I put them out for you guys, they're really for me. Because sometimes when I say stuff, and I recommend doing this, when I say stuff and I hear stuff, then I'm just like, oh, well, I guess there's like part of me that's so afraid of the Roux-en-Y because of the lack of vitamin, like your body doesn't, the absorption. But I'm not getting enough vitamins anyway right now because I can't even eat regular food. And then I'm like, well, that means I'm going to have to be on a liquid diet again, and then purees. And I'm like, pretty much I'm on that right now anyway. So not much changes except for the fact that eventually I won't have this continuous burning in my chest, waking up in the middle of the night and vomiting up bile. Like, really the only thing that could happen would be a positive life experience. So thank you guys for those of you who have chimed in and have encouraged me to seek help and to not be afraid of a Roux-en-Y, because it really has helped. It's really helped. And for people who have commented about, like, be careful what you say because, you can make people not want to have surgery, or this is only your experience. I totally hear that, and I acknowledge that, and I take ownership of that. However, I will also say this is not an uncommon thing for people post-decade of a vertical sleeve. And I'm aware of that. That's just the statistics are showing this. A lot of people are now, just like a lot of people who had the band ended up getting the vertical sleeve, and then a lot of people who are getting now the sleeve are getting the gastric bypass. And that's okay. It's okay. And some people are getting the gastric bypass from the vertical sleeve because they're not having success with a vertical sleeve. There's a lot of people whose vertical sleeves aren't as, like, their stomach sizes were different. And I'm doing a bunch of research of, like, why do vertical sleeves fail people? And some of it's the way that they cut the stomach. There's so much data out there. And, like, if I were to rewind the timeline, would I have done it differently? Would I have just done a gastric bypass, a Roux-en-Y? And I have to say, I don't think I would have. Even knowing now that I may have to have a revision surgery, I have been very happy with my sleeve. And those of you guys who are doing research and trying to figure out what's right for you, take into account your age, take into account your diet, take into account the foods that you like. If you tend to like foods that are a little bit higher on the acidic chart, like red sauces and things like that, then maybe go for, and if you tend to like more fatty foods, do the Roux-en-Y. You'll probably have more success in it long term. You just will, because of reflux and because of dumping, and it'll keep you accountable and making sure that you don't eat the wrong foods. But if it's more of just like a portion control, the vertical sleeve might be better fitted. Either way, if you're looking at having this surgery done, make sure you are not just treating the stomach issue, because you don't just ever get rid of a bad habit. You have to change that habit for a different habit. And that's the reason why there is transfer addictions, like alcohol, because you can drink as much as you want and you get drunk faster. And if you're not dealing with the reason you have an eating disorder, because you have an eating disorder, you're disordered eating, you're eating food for not just nutritional value, but because you're bored, or because you're depressed, or because you have a sugar addiction, or because, insert reason here. It doesn't matter. Anybody that's looking at having weight loss surgery where they have more than 80 to 100 pounds to lose or more, we're using food inappropriately. And when you have a restriction on the amount of food you can eat, and you, like, for a long time you're on like a liquid or puree diet, you got to find ways to replace your habit, or else depression becomes a real thing and transfer addiction becomes a real thing, not to mention all this other crap that I'm dealing with right now. That all being said, I've said it before, I'm going to say it again. I would do the surgery 1,000 times over. It was hands down the best thing for my life. Losing over 100 pounds gave me my life back. If I had not had that surgery, I don't think I ever would have gotten down to the weight that I got down to, and I would have been dealing with diabetes. I would have been dealing with a fatty liver. I would have been dealing probably with cirrhosis of the liver secondary to a fatty liver, because it was so bad. So sometimes we pick what evil do we want? I knew that this surgery came with complications, and I am willing to embrace those complications, and I'm here for it. And I'm putting this out there, not to be judged, although I'm sure I am by many people, but to be a resource and to be the person that I needed, that I need now, to be honest. Like, I need to see people like me now so I can talk to them. And when I made the decision that was the decision that was right for me, that 10 years, a decade into it, did she put back all her weight on? No, I have not put all my weight back on. I haven't. I look great. I feel comfortable. I mean, I'm fine. I'm a very medium-sized woman. I'm a very normal-sized woman. And I'm not too skinny and I'm not too heavy and I'm living my life and I've got some flops and I've got some bops and I've got some cellulite and I've got some lumps and I'm never going to be 18 again and I'm never going to have a six pack and probably never going to wear a bikini. And I'm okay with that. But I do want my health back and I do need to feed my body and my mind and my emotional stability. And that is multifaceted and I need a team approach for that. So just getting the Roux why, if that ends up being what happens to fix this, won't necessarily fix my eating disorder and disordered eating. And I'm working to change the phraseology that I have in my mind. I'm looking to change what I tell myself. I'm looking to do better and be better, act better, and recognize that I am not my eating disorder. I am not my body. I am not my size. I am not my weight, but I am a mother. I am a wife. I am a friend. I'm a business owner. I'm a therapist. I am a woman. I am a daughter. I'm a sister. And that's who I am. And all the other components that carry this skin bag are just that. They're just other components. And I just need to take care of my body. And I'm really working to separate those two things in my mind because the I ams have always been revolved around my size and my weight and very little about what I offer this world. And because of that, I've really struggled with thoughts of suicide and that I shouldn't be here. And that's just like a real thing I've dealt with. And I don't want to deal with that anymore. And I've, dealt with depression. I've dealt with anxiety. I've dealt with feeling like I would just be better not here. I would be like less drama. That would just be better. And that's not healthy thinking, right? Because I am needed here, and my boys need me, and my husband need me, and my friends need me, and my parents need me, and my brother needs me, and my clients need me, and my employees need me, and all of those things. And I am worthy, and I am more than a number, and so are you. And I'd love to just, if this resonated with you, let me know. The comments really help me keep posting, and the posting selfishly is a little bit more for me than you. And if I'm looking off, that's my ADHD, which I probably need to make a video about that. But that's because I'm processing, because if I see myself, I get distracted where I'm like, why is this doing that? So I look away so that I can process and say what I need in my brain. Okay, I think I'm going to call that a wrap for the video today. I will make another video later this week after my appointment with the bariatric surgeon, and I'll let you guys know. Wish me luck. Love you guys. Take care.